What is depression?
Depression, also known as major depressive disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Luckily, it is also treatable. Depression causes feelings of sadness or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble in sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, for instance, inability to sit still, pacing, hand-wringing or slowed movements or speech, feeling worthless or guilty, difficulty in thinking, concentrating, or making decisions, thoughts of suicide or overthinking about death. Symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for a diagnosis of depression. Also, medical conditions can mimic symptoms of depression, so it is important to rule out general medical causes. Depression affects an estimated 1 in 15 adults in any given year. And 1 in 6 people will experience depression at some time in their life. Depression can occur at any time, but on average, first appears during the late teens to mid-20s. Women are more likely than men to experience depression. Some studies show that 1/3 of women will experience a major depressive episode in their lifetime. There is a high degree of heritability, approximately 40%, when first-degree relatives, such as parents, children, or siblings, have depression. Some psychologists classify the symptoms of depression into 2 categories of physical symptoms and psychological symptoms. Physical symptoms may include loss of appetite with excessive change in weight, loss of interest in sex, loss of energy, even when not physically active, loss of sleep despite feeling exhausted, or sleeping too much or more than usual, slowed activity in speech. And psychological symptoms may include feeling miserable for weeks on end, loss of interest or pleasure in usual activities, slowed or inefficient thinking with poor concentration, difficulties making decisions or solving problems, recurring guilt and self-critical thoughts, thoughts of self-harm or being better off dead.
Types of depression.
There are different types of depression, some of which develop due to specific circumstances. Major depression, which includes symptoms of depression most of the time for at least 2 weeks that typically interfere with one's ability to work, sleep, study, and eat. Persistent depressive disorder, also called dysthymia, which often includes less severe symptoms of depression that last much longer, typically for at least 2 years. Perinatal depression, which occurs when a woman experiences major depression during pregnancy or after delivery, postpartum depression. Seasonal affective disorder, which comes and goes with the seasons, typically starting in late fall and early winter and going away during spring and summer. Depression with symptoms of psychosis, which is a severe form of depression where a person experiences psychosis symptoms, such as delusions, disturbing, false fixed beliefs, or hallucinations, hearing or seeing things that others do not see or hear.
Depression is different from sadness or grief.
Sadness can be a difficult emotion to deal with. It can be the result of loss, helplessness, or disappointment, among many other things. Sadness is one of the most common and natural human emotions. However, sometimes it is possible for sadness to deepen. and this may be a sign that you are suffering from a form of depression. Those experiencing loss often might describe themselves as being depressed, but being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. In major depression, mood, interest, or pleasure are decreased for more than 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. In grief, thoughts of death may surface when thinking of or fantasizing about joining the deceased loved one. In major depression, thoughts are focused on ending one's life due to feeling worthless or undeserving of living or being unable to cope with the pain of depression. Grief and depression can coexist for some people. The death of a loved one, losing a job, or being a victim of a physical assault or a major disaster can lead to depression. When grief and depression co-occur, the grief is more severe and lasts longer than grief without depression. Distinguishing between grief and depression is important and can assist people in getting the help, support, or treatment they need.
What causes depression?
No one knows exactly what causes depression. Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Genetic factors are important in many cases of depression, where depression seems to run in families, as do other mood disorders, and about 30% of the vulnerability for depression is due to genetic influences. Stressful life events also play a part in depression. Ongoing conflicts with others can take their toll on our well-being, as can other social and environmental stressors such as financial difficulties, retirement, unemployment, childbirth, loneliness, or loss of someone or something important. In vulnerable people, these stressful life events may be enough to cause or worsen depression. Personality style is another important factor. When people are depressed, they usually have a very negative view of themselves and the world. They do not appreciate good things, and bad things seem overwhelming. Some people have a tendency to view themselves and the world this way even when they are not depressed. In other words, they may have a depressive personality style. Other possible causes of depression that should not be overlooked are physical illness or medications. Glandular fever, influenza, hepatitis, thyroid hormones, anemia, diabetes, birth control pills, alcohol and substances of abuse, or certain medications such as those for heart or blood pressure conditions, may all cause symptoms of depression.
Risk factors for depression.
Several factors can play a role in depression. Biochemistry, differences in certain chemicals in the brain may contribute to symptoms of depression. Genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. Personality. People with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic appear to be more likely to experience depression. Environmental factors. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression.
In females.
Depression is nearly twice more common in females than males. Researchers do not know why depression appears to be more common in females. However, a 2021 study proposes that the difference may be due to disparities in reporting. Researchers found that females were more likely than males to report and seek treatment for depression symptoms. Some research suggests that exposure to gender discrimination increases the risk of depression. Also, some types of depression are unique to females, such as postpartum depression and premenstrual dysphoric disorder.
In males,
Some 5.5% of males report depression symptoms in a given 2-week period. Compared with 10.4% of females, males with depression are more likely than females to drink alcohol in excess, display anger, and engage in risk-taking as a result of the disorder. Other symptoms of depression in males may include avoiding family and social situations, working without a break, having difficulty keeping up with work and family responsibilities, displaying abusive or controlling behavior in relationships.
in college students,
Time at college can be stressful, and a person may be dealing with other lifestyles, cultures, and experiences for the first time. Some students have difficulty coping with these changes, and they may develop depression, anxiety, or both as a result. Symptoms of depression in college students may include difficulty concentrating on schoolwork, insomnia, sleeping too much, a decrease or increase in appetite, avoiding social situations and activities that they used to enjoy.
in teens,
Physical changes, peer pressure, and other factors can contribute to depression in teenagers. They may experience some of the following symptoms: feeling irritable, restlessness, such as an inability to sit still, withdrawing from friends and family, difficulty concentrating on schoolwork, feeling guilty, helpless, or worthless.
in children,
Some 4.4% of children and teenagers aged 3 to 17 have a diagnosis of depression. This figure has risen in recent years. Depression in children can make schoolwork and social activities challenging. They may experience symptoms such as crying, low energy, clinginess, defiant behavior, vocal outbursts. Younger children may have difficulty expressing how they feel in words. This can make it harder for them to explain their feelings of sadness.
depression in pregnancy,
Pregnancy is often an exciting time for people. However, it can still be common for a pregnant woman to experience depression. Symptoms of depression during pregnancy include changes in appetite or eating habits, feeling hopeless, anxiety, losing interest in activities and things you previously enjoyed, persistent sadness, troubles concentrating or remembering, sleep problems, including insomnia or sleeping too much, thoughts of death or suicide. Treatment for depression during pregnancy may focus entirely on talk therapy and other natural treatments. While some women do take antidepressants during their pregnancy, it's not clear which ones are the safest. Your healthcare provider may encourage you to try an alternative option until after the birth of your baby. The risks for depression can continue after the baby arrives. Postpartum depression, which is also called major depressive disorder with postpartum onset, is a serious concern for new mothers.
in historically marginalized groups,
Research shows that the prevalence of major depression among African Americans has been around 10.4%, compared with 17.9% among people who are white. However, 56% of African Americans experience depression more chronically, compared with 38.6% of people who are white. This implies that though fewer African Americans may experience depression, those who do may experience it for longer. In addition, less than half of these African Americans have sought treatment. Other research indicates that African Americans may have depression less frequently than non-Hispanic people who are white, but this may be due to the fact that many African Americans often do not have a proper diagnosis,